A 28-year-old woman comes to the physician with complaints of decreased hearing, dizziness, and ringing in the right ear for the past 4 months, right? Dizziness, decreased hearing, and ringing. Okay, so there is tinnitus, some hearing loss, and dizziness. Now, you can just write it here. Some tinnitus, hearing loss, and dizziness. You can just say like imbalance, right? Physical examination shows multiple cutaneous neurofibromas. There is sensory neural hearing loss, okay, and weakness of facial muscles, right? Facial muscles and sensory, you can just sensory neural hearing loss and facial weakness, right? So there is compression. So probably some 8th nerve is involved and 7th nerve is involved, right? Then her gait is unsteady, which says her imbalanceness, right? And a tuning fork placed on the forehead is best heard in the left ear. Now, air conduction is greater than bone conduction bilaterally. So that means bone conducting hearing is normal, right? Only sensory neural hearing is abnormal. Then wait, what is the most likely cause? So you can say here, there, if it is a unilateral one, you can just say like, Schwannoma's tumor, right? But if it is a bilateral one, then you can suspect a neurofibroma of type 2, right? Because it is usually involved with your bilateral acoustic neuroma, right? So that is why option A is your right answer, right? Because if whenever there is a tumor in this, whenever the tumor arises from the Schwann cells, then it will start compressing other nerves as well. Along with this 8th nerve, there is 7th nerve compression, 5th nerve compression. All those would be involved, right? That is why this patient is probably having a facial weakness, facial paralysis would be there. All those things would be there, okay? And usually the diagnosis can be done by an MRI or a CT, okay? Now, what about other options? Mania disease is, you will see tinnitus, yes, but there will also be vertigo, episodic vertigo would be there, ear fullness would be there, right? Those things are not here. Then cholesteatoma, here there would be a conductive hearing loss, right? So no. Eustachian tube dysfunction, usually you will see a popping sensation along with conductive hearing loss. So no. Herpes zoster oticus, this you will see with an ear pain, right? Facial weakness would be there. Okay, I get it. But there would also be a vesicular rash in external auditory. Sorry. External auditory canal.